Tuberculosis has for days on end been labeled as a killer disease in Uganda, and the statistics of its burden here speak louder than the proverbial empty tins. Approximately 91,000 people contract TB every year, translating to about 240 people daily. 2 of every 100 people with TB have drug-resistant TB that is not cured by first-line drugs, and approximately 30 people die from TB every day. More than half of TB-related deaths are among people living with HIV, while about 15% of TB patients in Uganda are children aged below 14 years. However, the disease is curable, at least according to Fred Ebil, a TB survivor turned advocate. Ebil battled the bacterial infection for 2 years between 2018 and 2020.
On multi-drug resistant TB, that is the treatment I've been going through. When they actually discover that you have an MDR TB, you go through a treatment of 2 years. That is 6 months on injection plus taking tablets.
Ebil said he was saved from death by accessing treatment.
I used to actually take 16 tablets every day, and it wasn't actually an easy thing. It made me actually to go through a lot of experience. Me, like you are seeing me at the moment, people wouldn't believe, actually I couldn't even myself believe that I would be standing right now. Because by the time when they removed me and then they took me to the facility, most of the people, they had already concluded that I'm dead.
For a fact, lives of over 500,000 Ugandans have been saved with effective TB treatment since 2015. This, according to the Assistant Commissioner for TB and Leprosy at the Ministry of Health, Dr. Stavia Turiahawe, is one of the interventions to the fight against TB in Uganda.
So across the country, we have over 300 testing facilities that have capacity to test you and know the TB you have, the type of TB you have. These are gene expert-like machines. In every health center 3 across the country, we have services for testing which use the microscope. Now, we have also introduced testing at community level, where we use the mobile digital X-ray to help us in the screening among key and vulnerable populations. And also the vans, we have a mobile clinic, we have fitted them with the gene expert. So we can take a picture, see how the status of your lungs is like, and also after we have seen that there is a problem, ask you to give us a sample and we test it on the gene expert on the spot in the community. It's completed treatment. Now there are advances that have come up that we are looking at introducing. There are 4 months options for TB treatment, but these are not yet wide available. We are still trying to test how we roll these out as a country. So that is in terms of treatment. So both treatment and diagnosis are available and free of charge, supported by the government and our partners.
But in 2021, Uganda joined the list of the top 30 TB-burdened countries. What explains this?
The uptake by the people who need the service is still low. And it comes back to the awareness issue. Someone gets a cough, they go to the clinic and buy something, and they move with their cough. So if you have cough, fever, it's important to think about, and they have stayed with you for 2 or more weeks, think about tuberculosis and go to the nearest health facility. The other symptoms is patients will not like to eat, so they will present when they have lost weight, underweight for their age. So you lose weight. The other key, and if you're a child, you not grow well, so you not put on enough weight for your age. You say child who is not gaining according to what they are supposed to be for their age. The other symptom, you can see swellings on the body. That is when TB is affecting other parts of the body.
On the other hand, a bill says stigma and discrimination have impacted negatively on the efforts to fight TB in the country.
You find the way how the nurses, the people whom they are supposed to give you treatment, sometimes they can make you to stay from morning even up to around 2. Sometimes when you come when you have not covered your face with the mask, they can shout from a distance, "Can you cover your whatever with the mask?" And sometimes, in fact, there is a lot. And it is much at the facility more than at the community. It made me, I left the work. I said, even though it is a government work, even though they are paying me salary, but I can still make more good life, more than where I am at the moment.
There is a TB corner. What is the purpose? It is to keep the patients of TB away from others. But what message are they sending to other people who have come to use the services? Definitely it is also another form of discrimination which is intended, but I believe there could be another way of supporting patients without feeling that they are being discriminated because of the TB. Right now we know there are protective gears a person can put on when is in public. We also know that once this person is already put on treatment, like as I said earlier, then this person is not infectious. So the health workers need to be sensitized now.
A research paper on human rights, TB legislation and jurisprudence published in 2017 by the National Library of Medicine noted that people with TB experience infringements on their human rights on a daily basis. In far too many cases, they lack access to effective testing and treatment, face discrimination in employment and healthcare settings, and are unnecessarily detained and isolated against their will. The bill says medicine shortages are common here.
Especially in the government hospital, when you are given freely, but you normally go through a lot of strategy of you wait, you might begin from morning up to around 3 or even up to around 4 when you have not yet got treatment, and yet you are supposed to go back and go and do other things.
We asked human rights lawyer George Musisi whether one can sue government for infringement of rights because of failure to get drugs, and this is what he said.
We saw a High Court decision where they said that the government had failed in its duty. It's called David Mugera versus Attorney General years ago, where they said that government had failed in its duty where a mother died due to lack of basic maternal obstetric services, and they said that the state had a duty. So fortunately, the Supreme Court tried to leave that window open, although there's been a lot of legalistic judicial evasion of these rights by saying that yes, government should be held to account. And for me, I think that by the Supreme Court leaving that window open, by not saying that these are political issues that should not be questioned into, it leaves the room open for the issue of health rights, that yes, a person can sue government for failure to access medicine or even basic health services.
TB prevalence in Uganda is higher at 253 TB cases per 100,000 population than the previously reported estimate of 159 TB cases per 100,000 population. Walter Mwesije, NTV.